Hi everyone, for this video we'll be discussing the serology of group A streptococcal infections. We'll also discuss serological tests for the detection of streptococcal antibodies. So we have here a question: which two of the following tests are helpful for documenting previous streptococcal throat and skin infections? A. Titer and Anti-DNAse B. B. CAMP and PYR tests. C. Coagulase and catalase tests. D. Bacitracin and SXT. We'll go back to this question after the discussion. Group A streptococcal infections are caused by Streptococcus pyogenes. Major sites of infection are the upper respiratory tract and skin, with pharyngitis and impetigo being the most common. We have here a picture of streptococcal pharyngitis, or more commonly known as strep throat. And below, we have here the characteristic lesions of impetigo, which are honey-crusted lesions. Infection with strep pyogenes can give rise to sequelae, such as acute rheumatic fever and acute glomerulonephritis. The diagnosis of the sequelae necessitate the documentation of previous group A streptococcal infections. This is where your serological test for the detection of streptococcal antibodies become useful. We have here the various streptococcal antigens, or streptococcal extracellular products. All of these antigenic products, except streptolysin S, are immunogenic. Antibodies present are markers of streptococcal infection only and not protective. So the various streptococcal products include streptolysin O, streptolysin S, hyaluronidase, streptokinase, deoxyribonuclease, and nicotinamide adenine dinucleotidase. Then we have here the various antibodies elicited by these streptococcal products. As you could see, there is no antibody against streptolysin S, since streptolysin S is not immunogenic. Now you have to remember the difference between streptolysin O and streptolysin S, since this may be asked in your exams. Streptolysin O is oxygen labile, whereas streptolysin S is oxygen stable, meaning streptolysin O is destroyed by oxygen, whereas streptolysin S is stable in the presence of oxygen. We have here the various serological tests used in the detection of streptococcal antibodies. The first one is the determination of anti-Streptolysin O titer. The patient ASO titer begins to increase approximately 7 days after infection and peaks after 4 to 6 weeks. The determination of the anti-streptolysin O titer is based on neutralization of the hemolytic activity of streptolysin. If the patient has produced antibodies against streptolysin O, these antibodies will bind streptolysin O and prevent it from causing hemolysis. Another serological test is Anti-DNAse B testing. Anti-DNAse B sometimes appear earlier than anti-streptolysin O in streptococcal pharyngitis. So meaning both anti-DNAse B and anti-streptolysin O are actually produced after streptococcal pharyngitis. Sensitivity is increased for the detection of glomerulonephritis preceded by streptococcal skin infections, as ASO antibodies are not stimulated by this type of disease. Okay, this is the advantage actually of anti-DNAse B testing, since anti-DNAse B is commonly seen after streptococcal skin infections, whereas your anti-streptolysin O is not. And for your anti-DNAse B testing, the measurement is also based on neutralization. If anti-DNAse B antibodies are present, they will neutralize reagent DNAse B, preventing it from depolymerizing DNA. Presence of DNase is measured by its effect on a DNA methyl green conjugate, or a DNA methyl green complex. This complex is green in its intact form, but when hydrolyzed by DNA, the methyl green is reduced and becomes colorless. So in the presence of anti-DNase B, the depolymerization of DNA is prevented. So the complex will remain intact and there would be no color change. Lastly is Streptozyme testing. This is done through slide agglutination screening tests, okay, for the detection of antibodies to several streptococcal antigens. Sheep RBCs are coated with streptolysin, streptokinase, hyaluronidase, DNAse, and NADase, so that antibodies to any of the streptococcal antigens can be detected. So as you could see, using the Streptozyme test, we are able to detect multiple antibodies against various streptococcal antigens, increasing therefore the sensitivity. Okay. So this is the question again. Which two of the following tests are helpful for documenting previous streptococcal throat and skin infections? The answer would of course be letter A, as a titer and Anti-DNAse B. In our next video, we will be discussing the serology of syphilis. Okay, and if you want to know the answer to this question, please watch our next video. Thank you for watching this video. If you think this video is useful, please like this video and subscribe to our channel.